Hi, my name is Orly, and I'm going to talk about crowdcuring. Imagine yourself at the top of the world. Strong, full of energy, happy, about to do what you love most, skiing. Ever since my days in high school, being a champion in high jump and parallel bars, I loved sport. I served in the military as a sport trainer of male combat fighters. Enjoyed swimming, dancing, hiking, biking. Enjoyed life. And then I did what I love most. I went skiing. I'm at the top of the mountain in Austria. Blue sky above, white virgin snow below. And I start descent. All of a sudden, my strong legs didn't obey me. I crashed. I lost conscience. I was taken to the hospital. Luckily, I didn't have any brain damage. It took about a year of 50 different examinations to unroll monsters like ALS or brain tumor. Eventually, I found myself in a very small clinic in Jerusalem in front of Professor Lusus, a neurologist. In the year 1991, he discovered the disease, APBD. It's still difficult for me to pronounce the full meaning of the name. I'll try. Adult polyglycogen body disease. Okay, I did it. APBD, as I looked up, is a genetic disease that affects the nervous system by accumulation of abnormal glycogen that is caused by defected gene. It took another 2 examinations to officially diagnose me with APBD. I sat with Professor Lusus, with my husband next to me. And Professor Lusus looked at me with his good eyes, full of sadness and mercy. He told me, this is as uncured it is. It's cureless. It's progressive. Pretty soon you are going to sit in a wheelchair, never to get up again. Wow, this was a heavy load to bear. I thought to myself, okay, Orly, you have 2 options. Option 1, act as probably most of the people will do. Accept the verdict and start counting your days backward. But there is a second option, to fight, not to give up, to turn every stone till you find a solution to the disease. It didn't take very long till I looked at Professor Lusus and told him, I am going to find a cure. He looked at me with a sad smirk, and you can see what he really thought about my last statement. He told me that the disease is so rare, only 12 patients in Israel and about 70 in the United States. No pharmaceutical company is going to develop any cure for such a small amount of people. Nevertheless, the other day, I sat down and I started to send email to every chief scientist in the 57 exactly, pharmaceutical company around the world. Pretty much immediately, I was asking them if they can help me, if they know of any drug that can improve my situation. They couldn't. But they answered me. Each and every one of them answered me. Isn't our world amazing? Encouraged by that, I located all the Israeli patients and I arranged a group of people. I also connected with the American organization of APBD patients. I was so happy that I'm not only going to this quest only for my own sake, but for other people too. I went on with my quest. I found out that in the United States, in order to get a grant for medical research, you needed to dedicate 5% of your grant to any rare and orphan disease. And I found out that there are five researchers that choose my disease to search. I contact all of them. And pretty much when I was on my way to New York to meet all of them, I was so surprised to find out that they never met each other. Each one has a different way to tackle the problem, but they didn't speak to each other regarding that. They never met. So I was sitting with them. I brought along my scientist, my angel scientist, Or Kachlon, from Hadassah Hospital, who is completely devoted to looking for the solution with me through this difficult way. And it was unbelievable. It was a great meeting. I learned so much, and I established a relation for future collaboration. Professor Hassan Akman from Colombo University introduced me to guaiacol. It's a material known in the pharmaceutical industry for years, but he gave it to sick mice he developed with APBD, and it improved the situation. Immediately I started taking it. Another professor, Pablo Escriba from Spain, who joined us in this meeting, developed a food supplement that's called TGM5, and it was approved by the European Authority. It increases the activity of my poor enzyme by 20%. What? 20%, imagine. I start taking that too. Taking those two drugs improved my situation, and I feel it's really slowing down my progression. Being so happy about that, I felt very privileged to be involved in another connection. The sick mice of Professor Akman from Colombo University did a pilgrimage voyage to the Holy Land to take a part in another test of Professor Miguel Veil from the Tel Aviv University. A test that seems to be very promising, so promising that one of the professors that were with me in the meeting in New York, Professor Miassini, who is searching for a cure for a difficult and similar disease called La Flora, is using that too, and he's trying to find out if it can make any better for those poor children that suffer from La Flora. So, what a voyage from Tel Aviv to New York, back to Tel Aviv, and now to Dallas, to the Children's Hospital there, to Professor Mancini. And I'm not even a doctor. So, I went on with my quest. I found out that an Israeli company called Protalix developed an imitating enzyme for sick people with Gaucher's, which their enzyme failed to break down the fat cell. The imitation works so good, when they get this imitated enzyme, they become very healthy. So I approached immediately the chief scientist of Protalix. He knew about my disease, but he told me no way they are going to develop an enzyme like that for less than 100 patients. It's not profitable for the company. But I said to myself, it might be a direction. Maybe to create a World Bank of enzyme. There are so many sick people around the world with rare diseases that one enzyme can help others. And people, millions of people, can be healthy if there is a bank like that. So another door knocked on was the door of the World Health Organization. And I hope after those Corona days, we are going to have a meeting in Geneva to find out if we can promote this initiative. So I look backward. Me, Orly, I'm not a doctor. Maybe my expertise as an event organizer to connect people, to encourage them to be involved, to see who can help me in this initiative, helped me a lot. But if I can do it, everybody can. I'm Orly. I feel blessed, and I thank you very much.